Hello and a very good evening to all our viewers who are joining me live in this Facebook and YouTube interaction of News9. And today I will be speaking about the result that was published by the ICMR, and these results were attributed to the sero-survey that was conducted in the month of May. So in the month of May, India had close to 6.4 million COVID-19 disease patients when samples were collected for the Indian Council of Medical Research's first national sero-survey to detect the prevalence of the viral disease. And according to the findings that were published 3 months after the results, these were first made public in June. And the results that were made public in June clearly indicated that close to 6.4 million people had, been infected by COVID-19. And in the percentage, the national prevalence was found to be 0.73%. And the worst affected were those between the age group of 18 and 45 years, as 43.3% had developed antibodies against SARS-CoV-2, which causes COVID-19. And while COVID-19 patients in the age group between 46 and 60 years were accounted for 39.5% of the sampled individuals altogether. So close to 30,283 households were surveyed and 28,000 individuals had enrolled for this particular study. And now the ICMR has published the results, and the results, like I said, claimed that 6.4 million people had contracted COVID-19 in the month of May. So to give us more insights on this particular report, we have with us Dr. Sitesh Roy, who is joining me live in this Facebook and YouTube interaction. Many thanks for joining me live, Dr. Sitesh. And my first question to you today is that what is the point of ICMR publishing the results, 4 months down the line?
So Deepak, it takes some time to actually run these numbers and get the right kind of what we call prevalence data. And this data is very important because I am sure this will be followed up by further information that comes in the coming weeks and months on how this number is growing.
Okay.
The relevance of this number is very important because we can then know that back in May, we had, people are talking about herd immunity being achieved when 60 to 70% of the Indian population potentially has antibodies to the SARS-CoV-2 virus that causes COVID-19, and we are at 0.73%. And it's important to know because I am sure that in May, after May, the June, July, August surveillance information, sero-surveillance information is also being studied. And that is really how we will know whether there is a shift in the segments of population, in the age groups that are getting affected. It's not a surprise that the 18 to 45 is the most affected because that's the most mobile group that happens to be most extroverted and outwardly, whether it is in terms of work or doing other things, knowing that they are less likely to catch the infection and more likely to interact with more people, and the elderly staying home and having less problems, but ultimately the young people getting the virus to them. All of this is information that we gather from this seroprevalence study. So we as physicians and certainly the healthcare planners for our country and the decision makers do utilize this kind of data very carefully to know the trend of the disease. So it is still very relevant to be published even now.
Also, doctor, now when I was, giving our viewers a bit of the details, there was something called the national prevalence, which was found to be at 0.3%. So what is national prevalence and what is this number that, we got through this study?
So essentially, when you say that 6.4 million people were basically infected with SARS-CoV-2, by the month of May, you're talking about 64 lakh people, for people who don't understand the million figure.
Yeah.
So we are talking about 64 lakh people out of an Indian population of 130 crores. That's basically what this number means. It is a minuscule fraction of the number of people that can be estimated to have been infected, whether by a mild form or an asymptomatic form, but certainly something that we
utilize, as I said, in terms of prevalence data, that means the number of people within the community who have had the virus and potentially recovered from it. There must be some who would have died from it also, but getting that number is what the national prevalence tells us, is that out of those 130 crores, 64 lakhs were affected by the SARS-CoV-2 virus as of May 2020.
Also, doctor, now how relevant do you think these numbers will be in the current scenario? Because 4 months have passed and the results of the sero survey which was conducted in May is now out. So what use will be these numbers?
So we do need current numbers to know where we stand, but that's basically how antibody testing happens. It happens serially, it happens sequentially, it happens over a timeline, not as a single point measurement like this would have been. And so this just gives us an idea of where we were. We know that as the number of active cases and recovered cases have gone up in India, we know that the number of people who would have never been tested because they had asymptomatic infection or very mild infection, or some that did not come into the purvey of the investigations and testing, tells us that these numbers will rise and have risen. And the future data that will be released is the only way to know how that trend is going. Though we know, based on those general figures of day-to-day cases that are coming positive, and the number of deaths or hospitalizations, we know that we are still in the upswing or the growing phase or the rising number of cases phase of this disease. So all we can look at is retrospectively where we were and prospectively where we will be in the future.
But also, doctor, if you look at this particular study, in May, when it was conducted, the medical infrastructure that was present there was not up to the mark like how it is today. So probably the sero survey that was conducted was not conducted on a massive scale. So do you think that these numbers would probably be of use to anybody right now?
So I think that that's a very important point, Deepak, and in any sero surveillance to be successful, like most of the sero surveillance was going on in Delhi, Mumbai, possibly certain places in southern India or in Gujarat. And really that gives us soundbite information about the seroprevalence. Also, the COVID Kavach was the antibody test that was used. And if we go even with the most recently published sensitivity results of this test, it's possible that we may have missed anywhere between 15 to 25% of people who had possible exposure and hence had antibodies but were not detected on the test. So our number of 0.73% would go up to 1% if we take that error in the test and extrapolate the information that we have.
Okay.
Also, as you said, we are getting bits and pieces of information from parts of India. It doesn't necessarily mean that the states or the cities that have subsequently seen a rise in cases were necessarily sero surveyed. In that, though, the try or the effort is always to get the maximum, what we would call nationally relevant soundbite of the number of cases. But yes, that is also a limitation that is very much there in a seroprevalence study that was done back in May. We would do much better now.
Right. And doctor, how is this sero survey conducted and why does it take 4 months for the testing agency to come out with the results? What is the procedure that is involved while conducting a sero survey?
So in conducting a sero survey, the biggest thing is there has to be care taken that it is not a bias. So if you only go into the hotspots and do a sero survey, you will get a result that 50% of the population is antibodies. So sero surveys have to be done with a lot of what we call randomization. The randomization takes time, which cities, which towns, which areas you will select. Then actually getting the ground staff on the ground to go and collect the blood. Not everyone agrees or cooperates with the testing, so that takes time. Once you have the data back, actually getting the test, collecting all of the data that you're getting from different, you're talking about 28,000 households, that's a large number of people. And then getting all that data into a central repository or a central location where the numbers can then be crunched and they can be looked at in a scientific manner with the right kind of statistical analysis to make sure that it is truly representative of the population that is being studied. All of this does take time. I believe that this could have possibly be done faster, but I think it also has to do with the type of data, the extent of the data, and the type of work that goes behind it to getting this data out. It does need to be done in a scientific and a careful manner. And at the end of the day, like I said, a single time point means nothing. We now need to know what the data for June, July, August is, and then look at subsequent time points to know the trajectory or the direction in which everything is growing or rising.
Right, Dr. Sitesh, thank you for joining me with all those insights. Well, that was the doctor giving his, opinions about the result that was published by the ICMR about the sero-survey that was conducted in the month of May. And these particular results that were obtained clearly showed that close to 6.4 million people had been infected by SARS-CoV-2, which causes COVID-19. So, like the doctor clearly mentioned, that these numbers will only help us to identify where the trajectory is going, whether the trajectory is on an upward trend, or if it's actually improving, if the situation is actually improving with a downward trend, if they take the current scenario into perspective. So these numbers are essentially to indicate how many people in that given population that was tested had the antibodies toward of COVID-19, and how many people were infected, and how many people among them could stay safe. Well, that was about the sero-survey results that were published today, and the ICMR has clearly given out its verdict from the month of May. And it still remains to be seen what the current scenario would be and how the results of June, July and August, where sero-surveys were conducted in Assam, Kerala, Delhi and even Mumbai. So all of these results are yet to be declared, and in the nearest future we hope that we get to see these results and also compare between what we witnessed in May and what the current scenario is. And this will probably help boost, or rather upscale our infrastructure, medical infrastructure, wherever necessary, in order to help curb the spread of COVID-19. So in order to stay safe, you will also have to follow all the safety precautions, no matter how many sero surveys or how many RT-PCR tests or how many rapid antigen tests are done. The onus lies in our hands, and that is to follow all the safety protocols. We hope that you're following all the safety protocols, because in every live interaction, that is the main point that we stress upon. Despite other topics that we discuss, the main focus or the main agenda that lies right now is following all the safety precautions. We hope that you stay safe and also make sure that the lives around you are also safe. And with that, it's a wrap on this live interaction. Until next time, take care and stay safe. Thank you for watching.